Auntie Nicole, and you are watching In the Know. March is Women's Month, and so in order to honor Women's Month, I have the pleasure to be here with my inspiration. I have Dr. Rankin. Hi, Dr. Rankin.
Hello, thank you for having me.
Okay, so my first question for you, I wanted to know, why was it that you wanted to become a doctor?
You know, becoming a doctor was my opportunity to blend science and having an impact on people. I've always been a fan of genetics and microbiology, and so I had worked in a research laboratory, and at some point I realized that while the science was there, I missed the people aspect, and so I came to the point that I should apply to medical school. I did. I attended medical school, and so being a physician has fulfilled that combination and that goal of wanting to be able to help people and still have fun with science.
So you chose anesthesiology. Why did you choose that specialty?
Oh, anesthesiology is a specialty where you have to be able to make an immediate impact on someone, put them at ease. Surgery is a very memorable time in someone's life, and most often patients aren't afraid of their surgery because they know their surgeon. They're most often afraid of the anesthesia. And so being an anesthesiologist, I have a unique pleasure of being able to walk someone through a very scary part of their lives and get them through that safely.
Yes, and I've had a chance to experience that myself, being under anesthesia, and almost could have had you. Wish I did, but the comfort of knowing that you would come in and console that patient is a great, it's great, and it's very welcoming and warm, and I do feel like it helped me to feel comfortable at that time as well, that you all come in and do that.
And in addition to anesthesiologists, again, we have the ability to make surgery safe. Procedures that weren't done many years ago are able to be done. We're able to, give conscious sedation, do regional techniques. So it's a great specialty.
Yes, it is.
And
So Dr. Rankin, okay, so you went to medical school and you studied your specialty of anesthesiology. How long? Because I want young girls, young ladies to understand, if you choose to go to medical school, like the time frame. Can you give us a little time frame?
Before I tell you how long it took me, I will say that one rule that I always practice is that it doesn't matter how long it takes you to get there as long as you achieve your goal.
Yes.
And so for me, I never looked at it as how long am I going to be doing this. It was just steps that I needed to do to get to where I needed to get to. So 4 years of undergrad, 4 years of medical school, and then anesthesiology residency is 4 years.
So that's an additional 4 years? Whoa, Dr. Rankin, I didn't know you were in school that long.
And in addition, after residency, I did a fellowship. So that's additional training in neuroanesthesiology. And so
now you all know why she's my inspiration. That's whoa, I didn't know it took that long.
But I think when you think about your goals, when you think that it's going to take you a year or 2 years to do it, if you focus only on that, 1 or 2 years down the line, you can still be complaining about how long it's going to take you to get to where you need to get to, or you can be getting there.
That's right. Remember that, young ladies. Remember that. So, can you take us through a typical day at the office or your day at home getting ready to go to work?
Well, my role is unique in that I have a blended position. I am an anesthesiologist as well as I have an administrative role. I am the residency program director. So that is
talking about, girl. Let them know.
So when I have a clinical day, I usually arrive to the hospital about 6:30. I see my patients. I take them through their day, and I usually end probably around 5 p.m. An anesthetic consists of a preoperative evaluation, intraoperative maintenance, and then postoperative recovery. So I walk each patient through that, and then come home and prepare for the next day.
So it's not, sometimes because you're not in private practice, you're more so in a hospital setting, so you don't have to work like a long 80 hours a week or anything like that, do you? Or are you typically 40 hours a week, or you push 60 to 80?
My week It varies.
Oh, okay.
It varies. I do take call, and I take several types of call. One type of call is in-house, because as an anesthesiologist, if emergencies develop, we have to be on site.
Yes.
And so I do spend some time in the hospital. I'll stay overnight and work. I'm also part of the neuroanesthesiology team, so I take call for that as well, which can be a pager call. And other times, you know, you're just there doing the work, and sometimes you have to stay until it's finished. And so
you can have long days.
You can have long days. But you know, when I go to work, I don't think about it as being work, because it's something that I enjoy. And the impact that I'm able to have is greater than me, and it's greater than any amount of hours that I'm putting in at work.
I love it, Dr. Rankin. I love it so much. I mean, I think a lot of us need to hear that part, you know. And I really thank you for saying that, because that lets me know that there is a lot of caring doctors out there that they rather give themselves and care more about others than themselves. That's very beautiful.
Thank you.
So, as an anesthesiologist, what are the biggest issues that you may face in your specialty?
Well, being a neuroanesthesiologist, one of the biggest challenges that I face is that you can't fix every patient. And I think that is difficult to deal with sometimes, because when individuals suffer injury to the brain and spinal cord, that can be catastrophic and life-changing. And so I think that's probably the hardest part. Nonetheless, you still go in, you give 110%, you do what you can for every patient to get them through some very challenging points in their life. Otherwise, you know, as a physician, the specialty of medicine is always a practice, so you have to make sure you stand on top of your game by reading and understanding what is the latest and best, and what are the best practices, and what are the standards of care. Being in an academic institution, I definitely have that extra perk of the system, because I'm around residents, I'm around medical students, and the drive and the initiative for learning is always there.
Do you enjoy the fact that it is a learning institution, or would you prefer to be? Do you like?
Absolutely. I feel like being an anesthesiologist in an academic center, not only do I get to take care of patients, but I also get to have a role in educating the future of our specialty. And so by engaging with residents and medical students, or even aspiring students who want to be medical students, I'm paying it forward. Someone taught me, and someone took the time to make sure that I had exactly what I need as far as clinical education and environment went. So that is my opportunity to pay it forward. So absolutely, academics blends for me both patient care and the medical education piece.
That is wonderful. That's wonderful. So if you hadn't become an anesthesiologist, what other specialty would you probably think you would have practiced?
You know, I don't know. When I was in medical school, I liked everything. I liked internal medicine, because you were like the detective and you had your own set of patients. I liked emergency medicine, because I'm like thinking of, you know, television and what is expected to be in the emergency department. And I enjoyed pediatrics because you got to be silly with kids and adolescents. But each of those specialties had aspects that didn't necessarily fit my personality or my ultimate goals. For instance, I enjoy immediate responses. And so in anesthesiology, I have that. If a patient has high blood pressure, guess what? I got medications to fix that. Whereas in internal medicine, and it's nothing against internal medicine, I think internal medicine doctors are absolutely necessary, so it's not a shot against them. But for me, I like the more immediate gratification. I enjoyed emergency medicine, but I realized once I got into anesthesia, there were a lot more acute issues that could be managed in comparison to my personal experiences of individuals maybe using the emergency department for more chronic issues, not necessarily acute emergent issues. And then pediatrics, enjoyed pediatrics, but for me, mentally and emotionally, I could not deal with really sick babies.
Oh, that would be hard.
So I think, I'm sorry, I haven't answered your question. Your question is, what would I have done instead of anesthesiology? I think I was fortunate to have found it. And I think I still would do it. Absolutely, I would do it over again. But I'm not sure. what I would have done.
It's great that you really found what it is that you enjoy. Like you said, you feel like you go to work and it's not work. I guess it's your passion.
It is. It's my opportunity to pay it forward and to give back. This is the set or the skill set that I have, and so, I think it would be selfish to not do that.
Give us some advice for young ladies who are considering to go to college, be it maybe medical school or whatever it may be. But if they decide to go to medical school, what advice would you give them?
Don't give up.
Number one.
Do not give up. There will be roadblocks. Those roadblocks may come in the form of individuals telling you that you can't achieve your goals. It will come in the form of challenging classes. It will come in the form of social distractions. You can't give up. You can't.
Number one.
There's a motto or a saying. I have quite a few sayings that have kind of gotten me through difficult times. And one is success. Success is defined as when opportunity meets preparation.
Thank you so much. I thank you for those words. I thank you for your time sitting down with me, and I can't express enough how much of an inspiration Dr. Rankin is to me and my daughters that I'm raising. So I definitely thank you so much for sitting down with me and being on In the Know.
Thank you,
Dr.
my pleasure.
Rankin. Thank you. Thank you for watching In the Know with Nancy Nicole. If you have any ideas, if you would like to be a guest or any products, please hit me on facebook.com/Nancy Nicole. Again, facebook.com/Nancy Nicole 1. You are now in tuned.